Okay, welcome everyone. My name is Dr. Prasad, and I'm going to do a short PowerPoint presentation just to acclimate you to the class and get you started. I'm probably not going to post a video each module, but definitely for this week, we're going to start with just a brief introduction. Again, my name is Dr. Prasad, and welcome. All right, so let's get started. Okay. Understanding mental illness and psychiatric disorders. So, we hear a lot today. People say this person has a mental illness. We might hear someone say, oh, such and such is depressed. But is the person really depressed? Does the person really have a psychiatric disorder? Is the person depressed in the sense that they're just sad, blue, maybe down because of a breakup with a boyfriend? Or do they meet the diagnostic criteria for a major depressive disorder? So, what I'd like you to do is pull out your DSM-5 TR and look up major depressive disorder. And you should always have your DSM-5 on hand when reviewing different drug categories to understand what you're treating, what the symptoms look like, and what is the diagnostic criteria for a specific disorder. So the DSM-5 TR is how we as psychiatric nurse practitioners diagnose psychiatric disorders. Each disorder will have a specific criteria, and if our patient meets this criteria, we're able to diagnose them with that disorder. Okay? So, what is the cause of psychiatric disorders? It's hypothesized that genetics, biological factors, neurodevelopment factors, psychological factors, substances, infections, trauma causes psychiatric disorders. Today, most commonly, the accepted cause of psychiatric disorders is what we refer to as a biopsychosocial model. This is the integration of biological factors, social factors, the environmental factors, and psychology. Okay. So, how do we treat mental health psychiatric disorders? Well, the first hand or the first component is therapy. We have many different forms of psychotherapy. We have cognitive behavioral therapy. We have DBT, which is a specific type of cognitive behavioral therapy, CBT, DBT. We have trauma focused therapy. We have psychoanalytical therapy. So there's different psychotherapeutic modalities. We also have holistic alternative therapies. And while the evidence is less robust compared to psychotherapeutic modalities, we shouldn't just dismiss it. And if you're interested in, you should research and look up different alternative therapies. But this is things like stress management, meditation, essential oils, sound therapy, light therapy. Okay. And then we have pharmacology, specifically psychopharmacology, and the core of this course. And so medications used to treat psychiatric disorders are called psychotropics. And these are chemicals that alter brain function and change a person's perception, mood, cognition, and or behavior. Now, right in general, there's 5 common types of psychiatric disorders. So we have class of antidepressants. So this is where you hear SSRIs. Okay. Antidepressants, SSRIs, are used to treat depressive episodes, major depressive episodes, but also anxiety disorders such as generalized anxiety, sometimes panic disorders. Okay. Then we have anxiety medications. So this is your benzodiazepines, this is your Xanax, your Ativan. There's also other medications that we'll get into when we get further into the course. Then we have antipsychotics, which are also known as neuroleptics. There is, I guess, a trend away from using the term antipsychotic because of the label to more neuroleptics, using neuroleptics as the name of the class. But these drugs are used to treat disorders such as, well, disorders with a psychotic component. So this is schizophrenia, schizoaffective disorder, perhaps bipolar with some psychosis. And if these terms, these disorders that I'm mentioning are very foreign to you, I strongly encourage you. Again, it's not going to be on the test, but it's so important to have context to look up in the DSM-5. Read the section on schizophrenia. Just familiarize yourself a little bit with the different disorders. Okay. And then we have stimulants. Oh, one thing I want to say about antipsychotics. So now antipsychotics are also used for other disorders such as treatment resistant depression and if I mentioned bipolar. Okay. Then we have stimulants, which is usually used to treat ADHD, most commonly Adderall and Ritalin. And we have mood stabilizers. And mood stabilizers, the most common is lithium. Okay. This is for patients that have experienced bipolar disorder, particularly bipolar 1 for lithium. And again, we'll get into that later in the course. Okay, so pharmacology principles recap. So anytime you see this ANCC banner, this means that the material most likely will be on your ANCC Psych NP certification. And it's important that you know this material. Is it important that you know all the material? Absolutely. But I guarantee you that this will be on your boards or a certification exam. All right, I'm not going to go over this. I just want to say that when it comes to psychopharmacology, when we talk about the different dynamics, we're talking about the target site for drug actions. And for psychopharm, this is usually different receptors, ion channels, and enzymes, sorry, and carrier proteins. Okay. Also, please, 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 it is very important that you watch this video here. I think it's a TikTok. Hold on one second. I think that's a TikTok video, but please watch it. You need to memorize everything in the light yellow, the farm fun facts. Please memorize. You need to understand what a half-life is. A half-life is the time required for 50% of the drug to clear. You need to understand why it's important for dosing. You need to also understand or memorize that it takes 5 half-lives to achieve a steady state. And so, what is a steady state? A steady state is when the amount being administered into the body, the amount of drug being administered into the body is equal to the amount of the drug being excreted or going out of the body. So, in pharmacology, particularly if we're on a medication that a person is taking every day, we want to maintain a therapeutic level, right? And in order to have that therapeutic, to achieve that therapeutic level, we need 5 half-lives. Well, each drug has a different half-life, so you need to know that. Now, when might you not want to achieve a steady state? Like if you're giving someone morphine for pain, you absolutely do not want to achieve a steady state, right? Particularly if it's acute pain because you don't want them to overdose and you don't want to have a person having so much morphine in the system. Okay, so let's see. Psychopharm is the study of the effects of the drug on nervous system and on behavior. Okay, you can look at this slide. It's pretty self-explanatory. All right. Now, I'm about to review the history of psychopharmacology. This is really just some context. You will not be tested on this. I just think it's really important that you understand, you're prescribing medication for your patients. You should have some understanding of where these drugs come from, the history, almost the culture. Okay. All right. So before the 1950s, individuals with psychiatric disorders or mental health struggles were mostly treated in asylums. And during this period, um, there really wasn't a medication for psychiatric disorders or psychiatric symptoms. Really, people were just sedated. Okay, so in asylums before the 1950s, treatment was focused on sedatives and hypnotics, which calmed patients but did not decrease psychiatric symptoms. Now, beginning in the 1950s with the invention or creation of Thorazine. Thorazine was synthesized in the 1950s, and this was the first psychiatric drug that actually treated psychiatric symptoms rather than sedate or put the patients to sleep. And this marked rapid developments in psychopharmacology that included antipsychotics and antidepressants. In 1964, randomized controlled trials, RCTs, became the gold standards, and this demonstrated both the drug's efficacy but also linked symptoms to dopamine imbalances. And this formed the dopamine hypothesis for schizophrenia, which we will get into later in the course. Okay. The modern era of psychopharmacology was marked with the advent of Prozac. Um, Prozac and the marketing of Prozac led to a cultural acceptance of psychiatric disorders, psychopharmacology, and marked a shift in public perception. Now, the initial, I guess, enthusiasm has waned somewhat in terms of psychiatric medication because or related to side effects and overprescription and waning or plateau of efficacy. All right, and so this PowerPoint slide is just a visual timeline of the history of psychopharmacology. All right. And this is just some more information. I'm not going to go over it. Again, you won't be tested on this. This is really just to inform your practice. But I will say that psychopharmacology, it was promised to cure, but has many hidden flaws. Research that was conducted by Kirsch in 2010 and Wang and his colleagues in 2018 has raised doubts about the effectiveness of SSRIs, particularly when compared with a placebo. However, and this is just a clinical from my clinical observation, I have had patients, and many of my colleagues have, or patients who have suffered from severe major depressive disorder that include an inability to function in terms of socially and occupationally, and a debilitated quality of life. And SRIs, again, which are in antidepressant class, have been very effective in treating some patients. So while there has been doubts raised, there are undoubtedly patients who benefit. Okay, I want you need to understand that in 2004 there was a black box warning placed on antidepressants because of the increased risk of suicidality in children, adolescents, and young adults. And I really would like for you to read about different lawsuits and legal issues that pharmaceutical companies have faced, because I think it's very important for you to be aware of these issues, particularly related to false marketing. And why it's important, because in practice, you might work at a place where you do have pharmaceutical reps coming in, giving you information, and they might have research to justify whatever they're saying about a particular drug. It's important to look at that research and evaluate it critically. Okay. All right. Okay. So psychopharmacology, scientific underpinnings. Why is it vital for the psychiatric nurse practitioner to have an understanding of neurobiology, including the nervous system's anatomy and functioning? So, why is this important? Well, it's important to understand how the nervous system is supposed to work. So, this way you can identify dysfunctions in the nervous system, because these dysfunctions underlie or are hypothesized to underlie psychiatric disorders. Okay, it gives us a broader understanding. It provides guidance on what to prescribe. It also is helpful for you to understand when you're reading the evidence, the literature. Okay, so true or false, the primary function of the nervous system is to transfer and exchange information. All right, well, you'll have to watch this embedded video to see if you're right. And if you cannot, if the video won't play for you, I put the link under here so you could just kind of copy and paste that, okay? All right, so this is the nervous system. It talks about how the nervous system is broken down into the central nervous system, which is just basically the brain and the spinal cord, and the peripheral nervous system. The peripheral nervous system is then subsequently broken down into somatic nervous system, and this is basically your voluntary movement. If you raise your arm up or down, this is your somatic nervous system in play, and your autonomic nervous system. Now, on this PowerPoint, I put automatic. So that's a Freudian slip, I think, because basically it is automatic, right? It's beyond your consciousness, okay? It's an involuntary movement, and it regulates internal body functions. It's innervated into smooth muscle, cardiac muscle, involuntary movement. The autonomic nervous system is further broken down into two divisions: sympathetic, which is your fight or flight response. So the metaphoric tiger comes into the room and you get really, really scared. You get ready to fight the tiger or run. That is your sympathetic nervous system engaging. Heart rate goes up, um, blood pressure goes up, respiratory rate goes up. Okay. And then you have your parasympathetic nervous system. So you realize that the tiger is just actually, I don't know, a post on the wall. Okay, a hologram, and your body starts to calm down. Your parasympathetic nervous system kicks in, and it restores you back to baseline. Okay. So again, just pay attention to the ANCC. You need to just memorize this stuff that the brain is divided into three main regions. Each region, what is it responsible for? And so, what are executive functions? Okay, this is planning, reasoning, decision making, working memory, reasoning, planning. So, if you read through this, and then I want you to think about which disorder is commonly associated with executive dysfunction, leading to difficulties with focus, organization, and decision making. So you think about that. Now, maybe you have it, maybe you know people who have it, but we're talking about ADHD. So what I would like you to do is look up ADHD, primarily inattentive, look up the diagnostic criteria in the DSM-5 TR and compare it to the frontal lobe's executive functions. And I just want you to see and notice the alignment there, okay, or lack of. Right? The temporal lobe, you need to know the different areas. Again, this is just memorization. Okay. You need to understand the hippocampus is involved in the formation of new memories. The amygdala is involved in emotional processing, particularly fear. Okay. The limbic system, you need to memorize this. Okay. All right. All right. So for this slide, I really want you to focus and memorize this slide. And I also want you to watch this video here. Okay. The basal ganglia is a part of the extrapyramidal system, a network of brain structures involved in the regulation of involuntary movements. This is important for you to know because many of the psychiatric medications, particularly first generation antipsychotics, okay, and this is like thorazine, these are the older antipsychotics, and we'll get into first generation and second generation later on, can can affect the motor system. And this leads to side effects such as tremors and rigidity and involuntary movements known as EPS. Okay. All right. Okay. And then we have the brain stem. And so the brain stem consists of five major regions: midbrain, the pons, medulla, cerebellum, reticular formation. Okay. The midbrain contains the cells that produce dopamine, norepinephrine, and serotonin. These are your neurotransmitters. Okay. And neurotransmitters are the chemicals that influence mood, cognition, and motor function. Dopamine is involved in the reward, feel good processing, and norepinephrine affects attention, arousal, and the stress response. Okay. So the uppermost part of the brainstem is the midbrain. Okay. And this plays a key role in motor control, vision, and hearing and alertness. So now this midbrain section contains two areas that produce dopamine, the VTA, the ventral tegmental area, and substantia nigra. Very important. It is very important. Also, substantia nigra is important for controlling movement, and its dysfunction is linked to Parkinson's disease. Okay, so where there's a loss of dopamine producing cells in this area, you're going to see tremors, rigidity, and bradykinesia, which is a slowness of movement. All right, again, you see the ANCC, rote memorization. You just need to know this stuff, folks. Okay. All right, and looking ahead, this is not for you guys. Okay, so that's it for our first session. I hope this was helpful. Again, this is an online course, but I did want to share this video. If it helps, I'm glad. If not, I'm so sorry. If you have questions, please feel free to send me an email, send me a text. I'm here to help you and facilitate your learning. I cannot but emphasize how important it is just to memorize certain things. As we begin to build on the course material, some things will become more about the application of knowledge, but you have to have this foundational biology knowledge in order to understand how the different drugs work on the brain and how different dysfunctions and disorders show up in terms of symptoms in patients. Okay. All right. So welcome to the course. Welcome to week one, and good luck.